professor and my fellow teachers. So here I'm going to present my presentation on intellectual disability that I have chosen from the given topics. I'm going to present basically explore three aspects of that: the characteristics of learning disability, and description of the impact of intellectual disability, and the implications for educators. So, to know about learning disability, the first thing that we should know is what is intelligence, okay? About the intellectual disability that is related to intelligence. So, there is a psychologist definition that said ability to reason abstractly, solve complex problems, and acquire new knowledge. Uh, this is what is when we think about measuring someone's level of intelligence, we take this as the parameter to measure. So, what happens when these abilities are delayed? That's what when we start to think about this diagnosis of intellectual disability. And intellectual disability is categorized by significant difficulty in both in two categories, that is intellectual functioning, that is in thinking, learning, reasoning, and problem solving. These functionings when do not work and someone cannot cope up with that. And adaptive functionality, the adaptive functioning is related with everyday social, conceptual, and practical skills. So when we find that there's practical application, basically this adaptive function is the practical applications of someone's intellectual ability. Okay, for diagnosis we have to see that someone is facing difficulty with both the aspect of intellectual functioning and adaptive functioning. Okay, so this is the term that previously we used to call mental retardation. Okay, so it is a neural disability that to characterize the intellectual disability, we can say that it is a neurological development disability. It comes from the development of someone's through the development process. So it has to be from the childhood of someone. If someone at the adult age or a later age, if so, for some injury, for some accident or sickness, if they become intellectual disabled, then we don't consider them to be intellectual disability. However, to talk about the characteristics of intellectual disability, consider someone is facing for someone learning is more concrete. More memory based. Abstract concepts are very difficult for them. Once they need to analyze and relate something, that becomes difficult for them. They are more of active learner. Passive learning is less likely for them. They are not able to use strategy for learning or problem solving, and they face difficulty with thinking ahead and planning. They can think about 7 days later or 1 year or 6 months or 1 month. They're just with their moment, and they're slow in responding, and they have difficulty in making self-direction and internal motivation. Someone has to motivate them and someone has to direct them, and they face difficulty in generalizing things learned across people and places. There are other ways to describing, but I'm taking something a layman way. I'm not trying to term them with medical term or other terms which might become difficult for layman like me. So once we diagnose this, there is a psychological evaluation. We first do one thing which is called psychometric standardized testing, mostly known as IQ test. That is administration of a standardized testing, an interview with the intake with his family, parent, caregiver, teachers questionnaires, behavioral observations. Based on them, we really evaluate, making a psychological evaluation to diagnose that whether someone has got intellectual disability or not. And then IQ test, which is a standardized IQ test, which is very important. If you look at this psychometric test analysis, there is a bell curve that we make. If you can see that people from 70 to 130, that the blue mark, where 85 to 115, those are the average People have IQ and 115 and above are the above average. And let's talk about the area where people with less than 70 and more than 50 are the people who are usually diagnosed as intellectually disabled, okay, whose IQ level is up to that. And there are other ways level of intellectual disability. There are mild disability, moderate disability, severe disability, profound disability. And their IQ is, if it is mild, then this is 50 to 69, moderate is 35 to 49, severe is 20 to 34, and profound disability, intellectual disability term when IQ level is less than 20. And there is age group that is divided, and the functioning, what are the functions they do. I'm not going in detail on that, it's written on that. Due to the shortage of my presentation time limitation, I'm not going into detail, okay. So we need to think what are the consideration in the diagnosis of ID, okay. So one thing is community of the environmental factors. What are the environmental factors involved with their cultural linguistic factors as also plays a vital role, and other disability that impact functioning like physical disability, blindness, deafness, other mental health diagnosis, okay. And there are other outcomes with this co-occurring condition that happens with someone who is intellectual disabled. Children with an intellectual disability are 3 to 4 times more likely to have another neurodevelopment disorder, mental health diagnosis, psychiatric condition. Possible co-occurring diagnoses include autism spectrum disorder, speech and language disorder, attention disorder, and which is known ADHD, and anxiety or mood disorders, and schizophrenia. And there should be a consideration for that, which we can tell that the way we should be. We have talked about the impact, and now the way we should be dealing with these people, what we should consider with them. Once we behave with them, we should always be considered, and we should be thinking and asking ourselves that, am I asking too much from the disabled person, or am I asking demanding something too fast, and recognize that the individual's need, wants, or desires are not the same as you have, okay. Establish a routine that is fulfilling to the individual but not overstimulating. Make sure that the individual and the caregivers are getting enough sleep, nutrition, exercises, okay, so that they can serve them best, all right. And then intervention of individuals with intellectual disability, how can adjust the environment according to the expectation. This is for the education of parents, siblings, teachers, clinician, establishing realistic, to need to establish realistic expectation. Visual support in the environment to increase independence. Use of schedules and routine plays a very vital role, because this kind of people doing the same thing again and again makes them in a habit, and they get like activity oriented. When the time comes up, they automatically do that. I have seen that from my personal experience. Allow more time for transitions, decrease transitions when possible. Repetition response to learn new skills. This is very, very vital. Repeating the same activity again and again helps them a lot. Talk less, decrease stimulation in the environment, infuse choice as frequently as possible, consideration for medication, which also plays a vital role. And then for the educators, need to support their education, and educators have a big role to play. But I personally think that we need to use assistive technology to support students with intellectual disability, use manipulatives to be using concrete to teach the abstract. To teach them abstract, they will have to use concrete like manipulative and other physical materials. Use suitable softwares. We need to use suitable software to teach academic subjects, teach them to use calculators in solving mathematical problem, and sometimes the help of one-to-one paraprofessional can help. And we need to design. The main thing is, to me, very openly to say, from intellectual disabled person, I don't want them to, I don't expect them or even want them to understand the rocket science kind of thing, okay. I don't want them to be a physician or a doctor, okay. If it happens, I don't have any objection. I want to put them with less pressure, and they don't have to learn analytical ability through solving a quadratic equation, solving a linear equation, and is good for them. So I personally suppose that personal skill, life skill, teaching them life skill is more important. Okay, education is just to develop their analytical ability. So design a functional curriculum to help the students to learn basic life skills. For example, being able to wash their clothes, being able to count money, I mean, so that they can just manage their financial affairs, being able to feel and manage basic hygiene needs. Keeping yourself healthy is a very important. So it's very important. And teachers should export them to general education curriculum and support them in a way that teachers might help them to become successful. Teachers should break down the content and provide positive and encouraging feedback and teach concepts on one at a time. Okay, and there is some tips for the classroom management, which is talking about life skill that I've said. Physical fitness, giving them knowledge about physical fitness is very important. Problem solving skill training is required. Medical problems in the classroom, and what kind of problems might occur, what kind of conditions might they face, they need to give them knowledge. And teaching life skills to students with intellectual disability is a very important thing. So these were the thing that I think I wanted to cover, and at the end I want to give some of the resources for educators, parents, and people, researchers who are interested can go through these resources. So while I was researching on them and had a look on them, and few of them I really couldn't go over, but I really collected them for the help. Okay, so here are the resources from the government agencies, and there are the resources for the general information that we can have. And the sources that I have used apart from that is the reading materials that provided by my professor, and those are mentioned over here. So thank you very much, and I hope you enjoyed, and thank you.